and welcome back to Keep Moving Uncut. I'm Dr. Tiffaney Hunter, and I'm a doctor of physical therapy.
And I'm Elijah. I'm a physical therapist assistant.
Welcome, Elijah. It's your first video.
I know, right?
All right, so this is Keep Moving Uncut, a channel all about keeping you healthy, strong, active, fit, keeping you moving and pain-free, but it's uncut because we don't do any
editing.
That's right. We don't do any editing. That's right. So if you got that wrong, it was just going to be wrong forever.
I know, right?
Okay. So don't forget, if you haven't already, please subscribe. Click on that little subscription button. Click on the bell. Subscribe, because the more you subscribe, other people get a chance to take a look at it and it gets more visibility. We're going to talk about ACL today. The ACL. What does the ACL stand for? Your anterior cruciate ligament. So our ACL is located right here. We're going to use our scale, and I'm going to let you know that it's right in between this. You have your big bone up here, your femur, this tibia down here, and that's your patella floating there. So right in between right here is your ACL, your anterior cruciate ligament. And we're going to talk about signs of that being torn, what you can do. So I'm going to show you two tests, but first of all, I'm going to tell you a little bit about that anterior cruciate ligament. We're going to talk about some ways that it can be injured. So what that ligament does is that it keeps this bone. Oh, he lost his leg. This is better though. So what it does is it keeps this bone right here from moving forward. So this ACL that's right here, it stops this bone from moving forward. So if it's impaired, it would just continue to go forward. What are some ways that you can tear that ACL?
It's mainly planting your foot and maybe twisting. Like you don't even need to have any contact. It can just tear by itself. Right? Very
good, yeah. And I love that because you don't need contact. A lot of people think, well, I didn't have a direct blow on my knee, or a lot of people will say that they did not have anyone aggressively like take them down. Well, it's something you don't need to have contact, just like Elijah said. So as long as you're planting that leg, but you're still moving or you're twisting on it, you know, you're shifting your weight, then that's a great way to tear that ACL right there. So I'm going to show you, now that Skelly is broken, I'm going to show you two ways that you can check and see if yours is intact. Also, I want to let you know that when it happens and you injure it, sometimes you'll hear a pop. And a lot of times you feel a lot of pain right along with that pop. Also, when you stand up on it, you feel a lot of instability because that knee wants to move around, that leg wants to go forward, and you feel a lot of pain with each step. So before I get Elijah on the table, I'm going to show you on Skelly's good leg. Skelly's is fault. All right, we're going to have to take him and fix him up. So we're going to bend the knee a little bit, just around there, about 60 degrees. You're going to pull forward on this big bone down here, and what you should notice is that if it moves forward considerably, that's a great sign that there's a tear. Now, before you do the side that you're concerned about, you're going to want to do the other side to see how much give it is. Every knee is going to be different. Everyone's legs are different. So if you check one person, you might have a little bit of a forward motion. You check someone else, it may not. So see what their normal is, check the other side. So if it's you or if it's your family member, check the opposite side first. Okay, the other one is you're going to bend it about 90 degrees this time. You're going to sit right here on this foot and pull forward. Same thing, you don't want this large bone right here to move forward. So let's try it with Elijah. So Elijah, if you'll go there, we'll move Skelly. Okay, so knee is bent. Let's see. So what I'm going to say is, can I move this pants leg up? Does this pants leg come up?
It's good, yeah.
Let's see. Let's see. We're going to, does it come up all the way? There we go. All right, here we go. So this leg, I would check it on this side, which is the side that we're saying would not be affected before this, so I'll know how much movement to expect. So let's say I've already checked that side. I'm going to relax this leg, bend it around there, and I'm just going to pull this bone forward, and I don't see movement on it. Now, if I wanted to check it the other position, I would bend it here a little bit more. I'm going to sit on his foot, and I have this leg relaxed, and again, I'm going to pull forward, and I'm not getting movement here. Now, if I did pull forward, and it gave, or you saw some movement, then it would be letting me know that there's probably a tear, and I might tell him, well, then we might need to go and let you have an MRI and get that looked at to see, especially if he's having a considerable amount of pain with it when walking.
So it looks like I don't have a tear, right?
You do not have a tear. You're gonna make it. There's no tear there. So and you're not having any pain, are you?
No.
Okay, so we're great. So again, that's an ACL. So if you have any concerns with that, if you have some more questions, please let us know. But that's a quick way to let you know if you're having concerns with your ACL, and a quick way to check for it. Thank you so much, and I'll see you next time. Bye-bye.